Growing drug addiction has affected our community drastically. For a personal insight into addiction and recovery, we spoke to Mike Duggan from Wicked Sober, an organization that helps team up individuals and their families with the addiction help they need.
Well, we work with a lot of family organizations in Massachusetts, try to educate them on overdose prevention methods, work behind the scenes and, discuss the situation of their loved one, either their son or daughter, of what's going on. But we also work a lot with addicts directly as far as offering support services and making phone calls with them. So this way they have some support trying to get themselves into a program.
So what types of addictions do you guys specialize in?
I would say majority of the phone calls that we receive nowadays is related to opioid addiction, either prescription pills that have led into heroin or just still, people using prescription pain medication at this time. Oxycodone, is definitely a huge drug that when I was growing up in Arlington was readily available and it was easier to get than alcohol for a lot of young kids. So,
right.
What families don't understand is oxycodone, is synthetic heroin in a pill, no worse, no different. And a lot of these, young teens are trying it, not realizing the addictive, capabilities behind it and how strong of a drug it is that they're taking until they're hooked, and then they can't afford their habits, so they make the transition into heroin because at first it's cheaper and more potent.
Then what was the hardest thing for you? I know you obviously were trying to get help and your family seemed pretty supportive.
A lot of places I contact, they greet you as if you're worth less than you are. They kind of look down upon you for looking for help. You go into a hospital and they're trying to throw you out as quick as you came in because they look at you as a junkie. Right. So the stigma is very difficult to break. So when you do call and get help, you go into a program and you finally get into a program and then you find out that you're only in there for 5 to 7 days, and they're asking you what you want to do when you leave there, which is unfortunate because I don't know how I should be treated. I'm very sick. My disease centers in my mind. It's my thinking. So they're the ones who should be giving me suggestions, telling me where to transition into, giving me options and resources. And unfortunately, that didn't happen. In a matter of a week, I was right back home to the same environment with the same friends. And it was just a matter of time before I was using and going back into the program. So it took steps. There was a lot of resources that were available to me that I wasn't even aware of existed. Same thing with my mother. She had no clue what program was what information was correct. There's a lot of misinformation out there. So it was very helpful to be able to speak to somebody and try to look into multiple options and really understand what's available to you and have somebody talk to you like a human being. It's easy to get in touch with us. They can either contact us over the phone. Our information is on wickedsober.com. So it's an easy website to remember as well, but either the person struggling or the family members that are seeing the signs and symptoms of somebody, it's very important not to ignore those signs.
I'm Hannah Perlmutter for Arlington Public News. Thank you for watching.